Hello and welcome to Ask Me Anything, a series from Security Magazine where security leaders answer your questions about the industry, from best practices for risk management to the ins and outs of their position. I'm your host, Madeline Laver, editor-in-chief at Security Magazine. Today, I'm joined by Holly Rasche, Director of Security Management Services at Northwest Community Healthcare, where she served for nearly 26 years to protect part of a major healthcare system in the Northwest Chicago suburbs. Holly is a leader in the healthcare security space and has been solicited to share her security and leadership insights on industry panels and with publications, including Security Magazine. Welcome, Holly.
Hi, how are you?
Thank you so much for joining us. I'm doing good. Readers across our social media platforms have submitted their questions for you today, so let's get into it.
Sounds good.
Awesome. The first question that we received was, what do you see as the main challenges in securing a healthcare organization today?
I think one of the main challenges that we see is really turning the um, healthcare environment culture of being a wide open, community based culture into a more secure environment, right? So, years ago, when I first started here, every single door was open. Anybody could come and go. It was visitors 24/7. And as the years have passed, and even more so in the recent years, it's become a much different culture of we want to know who's in our building. We don't want all of our doors open. We want to be able to control who's coming and going for multiple different reasons. Um, I have to say that thankfully, one of the good things that came out of COVID was the fact that we were able to really start locking down our campus and controlling who was coming and going. And it was culturally acceptable, right? So it was no longer, oh, I have to check in. It was, I understand I have to check in. And over the past 3 years, that's just really now become a natural thing for not just my healthcare environment, but multiple other campuses. And so we're just trying to continue to work on that. Implementing a visitor management system, a true visitor management system, is a change for people having to present an ID, right? Some people are still trying to get used to that. And so just having our community understand that what we're doing might be an inconvenience, but it's to keep them safe, is important, and sometimes a challenge.
Yeah, I mean, that's a really interesting point to bring up the balance between security and keeping that open community, especially when that's been traditionally there. But it's interesting how, like, you talk about access in terms of like visitors coming in, as well
Mhm.
as visitor management, like badges for staff, and how that was a culture shift.
Yes, yes.
No, you mentioned a bit about how COVID-19 has already changed the hospital security landscape in the long term. We had a question essentially asking that, how did COVID-19 change hospital security, like now that we're 3 years since the start of the pandemic?
I think that was probably the biggest change for us, and learning how to deal with visitors that were upset because they had to wear masks, or that they couldn't visit their loved one. But by far, I think the largest change that came was the ability to integrate what we wanted to do all along and further secure our campus. Um, and it's allowed us to close entrances that maybe weren't monitored before and leave those entrances closed. And our community that we serve has learned, okay, now I know I need to come in here. I can't go in there. And so that's been a great thing for us.
Yeah, I mean, it's kind of nice to hear a positive that came out of such a
Yes.
difficult time in the healthcare security space. I wonder, were there changes that you guys had to make in the short term that you didn't maybe have faded away by now when responding to COVID-19?
Um, Part of our department, we had hired additional staffing to take temperatures at entrances. And so those staff disappeared and integrated elsewhere into the organization. Um, our PPE has changed a little bit. We used to wear N95s for everything, and now we've gone back to wearing masks, just regular masks, which again also was a good and a bad, right? It was bad because we had to get used to it. It was a change and not seeing each other's faces. And sometimes the patients that we communicate with rely on facial expressions. In That's how they respond to us. So that was a little bit difficult. But that's probably the only thing that's really faded away. Um, from the security side, at least here at our organization, there was a lot of really great improvements.
That's really great to hear. And it's interesting to go into kind of that behavioral piece and the pros and cons of masking. We had kind of a shift in topic with another question. Somebody asked, what are the pros or cons of proprietary versus contract security cards in the healthcare space?
I can actually speak to that because for many, many years, we were proprietary and then we were outsourced for just over a year and we were brought back to being proprietary. And I understand the thinking behind it, right? Having a company create policies and procedures and do things that maybe you wouldn't want to normally spend time or money on looks like a benefit. But the reality is healthcare security is such a unique environment. Um, and it's much different than corporate security or mall security. And having a contracted security department who didn't have experience in healthcare security created a really difficult situation in getting them to understand why we do things the way we do, or why our staffing needs to look the way it does, or why we run overtime, or that we can't pull a security officer from a mall and put them at a hospital because there's different training requirements. Um, and we went from being, the hospital security officers that everybody loved, and then we were outsourced, and it was like, oh, well, who are you guys? Even though it was the same people, right? It's just a different viewpoint from staff, and so we quickly went back in house. Um, we are very, very thankful and very lucky here that we have a very supportive executive team that understands what we do and why we do it, and it really helped us bring us back in house. And that was several years ago now, but it was difficult, right, to keep morale up when you're being outsourced, and then um, your pay changes and all of those things that came along with it.
Yeah, I mean, it's interesting to hear that's like an interesting experience being proprietary and then going to contract and coming back. You mentioned training. Could you go into a bit of like some of the specialized training that security guards in the healthcare space should have?
Sure. We are required, because we deal with behavioral health patients, to have de-escalation training. So specifically here we use CPI, but there's all sorts of different really good training programs. And dealing with those types of situations, patient family situations, different visitor requirements. We have modules of training that we do for understanding what the hospital requirement is, and our regulatory agencies, Joint Commission, IDPH, all of those things are much different than it would be as if I were working at like Woodfield Mall, for example. That you don't need those requirements, right? You can take an officer, train him for a couple weeks, put him out on the street. Healthcare security, it's 4 to 6 weeks to fully train an officer, and so they understand use of force, like I said, de-escalation, all of those things.
Thank you for going into that. It makes me, I mean, think about how collaborative of an environment the healthcare security space is, where security guards do need that training, especially
Yeah.
in terms of like behavioral health incidents.
Yes.
We had a question too, kind of talking about that collaboration, and if you could speak to the role of interdepartmental collaboration in the healthcare security space.
For sure. Interdepartmental collaboration is a vital piece of having a successful security department in healthcare. Our officers really touch every facet of the organization, right? So we deal with people in every department, whether it be food services or environmental services or nursing, the doctors, and having that collaboration and rapport when we deal with different situations is important, um, to make sure that everybody's safe, to make sure that the staff are comfortable in coming to the officers saying, hey, I saw this. It doesn't feel right. It doesn't look right. Can you investigate? Or I need your help with this patient. Or sometimes, we see the same patients over and over again. So the collaboration between the doctors and nurses and security, you guys have seen this patient before. What works? What doesn't work? Um, some of our special needs patients, the same thing, right? And also having that collaboration so that if the nursing staff see an officer do something that maybe they feel wasn't right, they're comfortable in reporting that. and vice versa. If an officer sees something that um, nursing or somebody else in the organization is doing that doesn't feel right, that they're comfortable in addressing that or reporting that.
It's interesting how that kind of touches on what we talked about earlier, like that open communication culture, and how that really helps improve the organization.
Mm-hmm. Mm-hmm. It really
We,
does.
yeah, I mean, another question that we received was kind of touching on this, talking about like supporting staff. A question that we received was how can healthcare security leaders best support their staff?
I think the best way to support their team is to be on the floor, to be part of the team, right? Don't be absent. As a leader in healthcare security, I have a lot of different hats that I wear, but I always make sure that every day I touch base with my team, whether it's I see them in person or I call them and ask what's going on, and I stay integrated with them so that I know what they're dealing with. Um, they have an understanding of what I deal with, but I understand when they come to me and say, Holly, I need this or I need that. I understand why, and they trust that I know what they do. I have a little bit of a benefit. I started out here as a ER ramp attendant, escorting ambulances and people in the building. So, and I worked my way up through the ranks, and so I have an understanding of where they're coming from, and they tell me all the time they appreciate it, and I think it shows my support, and because I support them that way, that bleeds out into the rest of the organization. The nursing staff see I support my staff, and so they support my staff and they support me, and it just kind of grows into its own animal of itself.
That makes a lot of sense. And speaking of your career too, we had a question asking, what do you feel like has been the most rewarding part of your career in healthcare security so far?
Um, a couple things. I think the number one most rewarding thing I've seen in my career is watch my officers that start with me in their young 20s and grow into their careers, whether it be healthcare security, and they grow into leadership roles. Some of them have left, unfortunately, but they're successful police officers, and they're successful police officers because of the training and the skills that they've developed as healthcare security officers. And I actually have a couple that are nurses on the floors, which is great. It feeds right back into that collaboration, right? So they understand what security, the viewpoint that security is coming from, and they're a nurse, so they help the officers understand where nursing is coming from. So that's probably the most rewarding. Secondly, is watching our violence in the workplace numbers shrink, knowing that we're making a difference in training and educating our staff, creating an environment where our clinical staff feel empowered to report when an event does happen, and kind of moving that culture away from nursing staff feeling like it's part of their job, and getting them comfortable to report, and knowing that we have the support of not just my department, but as I said earlier, our entire executive team across the system is supportive of that. And to me, that's huge because that's not how it always was in healthcare security.
I mean, that's really like impactful to see both like the wider impact of the training that healthcare security officers go through impacting the organization, but also that like communicative, supportive environment. Thank you for going into that.
Yeah, for sure.
Yeah, well, that's all the questions that we had for today,
Okay.
but thank you so much for joining us, Holly.
Thank you for having me.
And thanks for listening to Ask Me Anything from Security Magazine. Remember to follow us on Facebook, LinkedIn, and Twitter to submit your questions to get answers in a future AMA episode. Listen to or watch more of the Ask Me Anything series on LinkedIn Live, Apple Podcasts, Spotify, or directly from our site, securitymagazine.com. See you next time.